Hello, my name is Sean McMillan. I'm an orthopedic surgeon for Virtua Health out of South Jersey.
Hi, I'm Jeff Abrams. I am an orthopedic surgeon working out of Princeton Orthopedic Associates in Princeton, New Jersey.
Today we're going to share our technique for the BioBrace RC, reinforced bioinductive implant, that allows for mechanical strength and biology at time zero for our rotator cuff repairs. These are just horizontal mattress stitches that are going to be used for the load sharing with the BioBrace. I want them out of the way so I can do my normal rotator cuff repair. So now I got a clean field, it's like nothing ever happened, and I can go ahead and start to put my anchors in. Now we've passed our mattress stitches. We're going to come back through that anterior portal and just pull them all out, right? I place my stitches anterior to posterior, and then I'll go ahead and tie posterior to anterior. We've done our initial repair of our rotator cuff, and at this point we can now go ahead and think about utilizing these stitches for our augmentation. So again, the design of this allows for us to pass our suture manipulator through the openings and sequentially pull our stitches out one by one, and in turn this will allow us not to tangle our stitches as we get ready to insert our BioBrace. We're going to go ahead and use our device in a cocking mechanism. We're going to be able to pull the door back straight up and off, and that'll load my stitches right through the BioBrace. And again, I've got my order. I've got my 2 white stitches anteriorly, but again, this allows me to have some sitting down where I want of my implant. And again, I can begin to tie these down sequentially in order to just give myself a little half hitch and a little bit of friction. Although in some cases, you may choose not to tie these down at all immediately. You might choose just to bring them over the top laterally into your device. I'm going to grab both of these white stitches here. I'm just going to pull them out, and I'm going to throw a half hitch. And again, percutaneous portals, nothing wrong with doing that as well. Sometimes we'll take a spinal needle to hold that down. This will allow me to get some sort of medial compression there. And I'm going to do my half hitches again through my posterior lateral portal here. And again, these are just meant to sort of give me some fixation, Jeff, so my graft doesn't slide.
And this fixation is really not anchor related, but only soft tissue related, meaning your graft is being sewn into your native rotator cuff muscle tendon region.
Yep, and that allows for that buzzword that we keep using, load sharing, to occur. It allows for the forces to be distributed across the rotator cuff in a way that unloads our initial repair and spreads the forces across the BioBrace from medial at the musculotendinous junction, where we know things can oftentimes fail, protect our rotator cuff, which is sort of sandwiched in the middle, and then obviously fixate laterally. So now I've gotten just a couple half hitches in, and I'm ready to rock and roll. And at this point, we can go ahead and uncleat our stitches from the back of our BioBrace RC. There's this rescue stitch, the all white one. We're going to unload it. And I've got my black and white stitch posterior laterals. So in this case, I'm ready to fixate with my Argos, and I like to punch with these. I'm going to go ahead and pull one of my blue stitches out this way. And here I'm going to use this. I'm going to come up underneath my cannula. I'm going to use it to pull down. And 1, it'll help my graft lay down flat, but 2, it's out of the way now, so I can go ahead and work. And again, I've got my blue stitch from posterior, black and white from anterior, my all black suture anterior lateral. This will allow me to go ahead and get ready to fixate with my Argo. So next, what we're going to do is we're going to take the punch. This is the Argo GENESYS. It is a biocomposite anchor, and I'm looking to figure out where I want this graft to lay down, so that way I can see and put it in place. I've cleared away some space on my gutter, and I'm going to go ahead and just fixate this to the bone there. Okay, Doc, I'll impact that in. But again, we've created our channel and our hole. We can now come down through, and the Argo, again, the way it's set, make sure your stitches are not twisted. We can come right into our hole here. I'll get my blue stitch from the posterior. I'll come get my light white and blue-black stitch up front, and then I'll come get my lateral stitch, which we docked out through a percutaneous accessory portal. I'm going to pull these out through here. And again, we're going to go ahead and make sure that we use our punch to identify exactly where we want to be. Excellent there. We'll go ahead and load up our second Argo biocomposite anchor. I think we can go ahead and unload our rescue stitch. We'll use our suture cutter. And then we'll take our final survey. There, we got our medial stitches. We're down fixated laterally with our Argos. We can see that, our cuff is laid down. The actual BioBrace overlays a little bit with that load sharing of the musculotendinous junction, which again helps protect us from a type 2 tear. Our primary repair is probably just lateral to those initial knots there for the BioBrace. And I think honestly, this is going to give the patient, a really good outcome.